announce that to you all. And please keep your microphones muted when the speakers are presenting. That way there's not a lot going on. And I also just wanted to share with you and actually invite those of you who haven't already done so to visit Mi Mentor's website and create a profile. So as an organization, and some of you already know this, but we are committed to elevating minorities and diversifying medicine by providing aspiring healthcare professionals like you all with events like these, mentorship, and other resources that can help you accomplish your goals. So this is one of the ways that the organization supports the cause for equality. There will also be a post-event survey that I'll announce at the end of this webinar. So please check your emails a day or so after the event and fill that out. That really helps us out a lot, and it helps us know what sort of events you all could benefit from. So this is the agenda that we have for tonight. We're going to start off with the UCSF PrimeUS presentation by Alexis and Anuvir, followed by a PrimeUS specific Q&A. So you'll have some time to ask the two presenters program-specific questions. Then we'll move along to Maria's presentation on UC Davis Prime Reach. And after her presentation, you all will have a chance to ask program-specific questions as well for that program. Then a few of our presenters will touch on other Prime programs that they are aware of at UC Davis and UCSF, but the main focus will be the PrimeUS and Prime Reach programs. And at the end of the webinar, we'll have a chance to answer any additional questions that we didn't get to and just open it up for any additional questions and also questions that weren't answered. So feel free to enter your questions in the chat box, but please try and wait until the end of each presentation. That way we can organize them better and make sure we get to your questions. Oops. Okay. So Anu and Alexis, I'll let you take it away from here.
Okay. Hi, everyone. My name is Alexis. I'm a fourth-year UCSF PrimeUS student. I'll let Anu introduce himself as well.
Hi, everyone. My name is Anu. I go by Anu. I'm also a fourth-year medical student in the PrimeUS program at UCSF along with Alexis.
So we're going to talk a little bit about our program, but I think I'm realizing that there's probably some people that are in the call who might not really know what Prime is. So I'm going to give a little bit, like 2-second background. Prime stands for Program in Medical Education. It was a program started in 2006 with taxpayer money and was written in law to try to expand the amount of students that were becoming physicians who are interested in working with medically vulnerable and underserved populations within California. And so every UC except for UC Riverside has at least one Prime program, each of them with a different focus. And so that's kind of the general, that's the link between all the different Prime programs of the different UCs. Can you go to the next slide, please? Or do I have control? Okay, perfect. So this is the mission for Prime. And I think, given the times that we're living in and kind of what's been going on currently, I think our mission is more important now than ever. It's important to have physicians clearly who really understand the social, political, economic determinants of health, as well as how, systemic racism shapes the health of the communities that we serve. And that's really the mission of Prime and of all the Primes. For UCSF Prime US specifically, we're focused on the urban underserved, specifically like the urban underserved in the Bay Area. And so this is our mission statement, but overall, every Prime's mission is to focus on creating physician leaders who will work with communities to try to improve the health outcomes in medically vulnerable and usually populations that are kind of on the outskirts of of medicine. Next slide, please. Okay, perfect. So this is the structure for UCSF Prime. It's a 5-year dual degree program in which you matriculate to UCSF School of Medicine or the UC Berkeley UCSF Joint Medical Program. So I'll talk a little bit about the UCSF one first. At UCSF, there's 11 students in the program, and every student is like, we're in a cohort, and every student kind of goes through this curriculum together throughout the 4 years of medical school and 1 year of the master's that you decide to do. We'll go into like exactly what happens in each year, but throughout your medical school education, you have additional classes, seminars, retreats, etc., that are meant to prepare you to become a physician working in medically underserved communities. The Prime program at the UC Berkeley UCSF Joint Medical Program, that's obviously a joint program between UCSF and Berkeley, where the students kind of have the master's built into their program. So it's a 5-year dual degree program to begin with, but they get an MS. And their structure is mostly dealing with like a problem-based learning, and it's in a very small group of people. I think it's like 15 students, is that right, Anu? Yeah, so it's 15 students in that program, and then 4 of those students are also in Prime. So they join us in the different seminars, workshops, retreats, stuff that we do. So that's kind of the main connection that the JMP Prime program has with the UCSF Prime program, but they're within the same one, the same cohort. And I think that's it on this slide. The only other thing to mention is that when it comes to the master's, students are allowed to do whatever master's they want. Most people decide to do a master's in public health because it aligns most with the mission of Prime and the mission that a lot of the students come into Prime with, which is trying to really understand like what are the systemic things at play that are influencing my patient's care, my patient's health and care, and how can I work to address that? And a lot of the times that translates into getting a master's in public health. But there's been people who have gone and gotten masters of social work, education, really whatever, business administration, really whatever you envision your future role as a physician is, and whatever degree you think can help you fulfill that goal is the degree that you can go for. There also is the option of doing like a research year if that aligns more with what you want to do, but you're highly encouraged to do a master's instead of doing a research year, but it is something that you can do.
Hey. All right, so I'll go over the curriculum for the Prime program, at least at UCSF for the PrimeUS program. So we start 1 week earlier than the regular cohort or regular MD class. So we go on a retreat where we get to know each other, do team building exercises. We also do lots of community-based, or we meet with community-based organizations, and also meet with public health officials. We went to City Hall in San Francisco during our first week of medical school, and we also learned about different services that are provided by UCSF and UC Berkeley universities. And it could be various different services for LGBT community, for other underserved communities within San Francisco area and the larger Bay Area. So that's the summer part of it. We start 1 week early where we just like try to like get to know the city and get to know each other. And then following that, we start MDs, our regular curriculum within our medical school, within our medical schools. And throughout the medical school for first 2 years, we have 2 to 3 seminars per month where we do meet with community-based organizations and learn about their work and how we as students can help them amplify their work or support them. And we're just there to learn basically for the most part, because the first step of helping a community is to actually getting to know the community from bottoms up. So that's what we do for the first 1.5 years for us, because our first 2 years of med school are 1.5 years. And during our third year, we don't really have much community-based work, but we do have occasional, check-ins with each other, because third year is the most it's the busiest year of med school. So there's no time for us to go outside of our clinic schedules, and everyone is on different rotations. So we do occasional check-ins every couple months or so, but we don't do any community-based work during that year. So after third year is when we actually get our master's degree, or if you're interested in a research project, you do a research project or whatever you'd like. So Alexis and I are currently starting, or in summer, we're starting MPH program. I'm going to UC Berkeley for master's in public health, and Alexis will be going to Harvard. So after third year, we finish our master's. We're both going to MPH programs, and you have a choice to apply to whatever universities you want to, and Prime is there to support you. And lastly, during your actual fourth year, which will be the fourth year of med school, but fifth year of the program, is when we do our capstone experience. So the communities that we met with during the first 3 years of med school, we actually reach out to them. We do a project with them. It's a month-long project, and whatever they need support in and however we can help, it's a project that we volunteer our time and do a scholarly project on. And other things included in the curriculum are mentorship opportunities, including the one that we're currently doing, and there's also Prime-specific mentorship opportunities, and there's always networking opportunities to meet with people with similar interests. And then there's other outreach activities that you can ask your Prime family to help you with. Yeah, so next slide. And then for application process, so it's basically the primary application is same for regardless of whether you're applying into Prime or not. And then once you get invited for the secondary application, you actually have to submit 4 additional essays, I believe, for UCSF, and the numbers could be different for different Prime programs. And they're same essays that are used for both the GMP Prime, which is the Joint Medical Program at Berkeley, and UCSF Prime programs. So the timeline is basically you submit your primary application, choose all the schools you want to apply to, and then go to the secondary application upon invite, and then you have a UCSF interview in person. And then for our Prime program, once you get accepted into UCSF MD program, then PrimeUS reviews your application and decides whether they want to interview you for Prime. And then based on that phone interview later with Prime, they let you know whether you're accepted or not, or whether you're waitlisted. That being said, you can still attend UCSF MD program even if you don't get into the PrimeUS program. So Alexis mentioned the last point already. There's currently 11 students at UCSF and 4 students at the UC Berkeley campus. Our main interaction with UC Berkeley Prime students is basically at the seminars that we attend 2 to 3 times a month. So why we chose Prime, there are a lot of reasons that I can talk about this, but I'll, in the interest of time, I'll quickly share why I chose Prime. So one, like it aligns with my experiences, my interest in urban underserved communities. So I hope to practice in Central Valley. I am a Fresno native and hope to come back to Fresno. And I think with UCSF Prime, they provide you with lots of networking opportunities, and you learn about different health inequities in the healthcare field. And I just wanted to address those concerns before I became a physician, and just learn more about the needs of the underserved communities, so I can look at health at a bigger perspective rather than just treating it in a hospital setting. So that was my main focus. And I think UCSF has an extension at UCSF Fresno. So with that, there's a lot of role for opportunities to network and collaborate with one another. So that's why I particularly chose UCSF Prime. And then also, I was part of the post-bac program before starting med school, and I realized that I really thrive in small cohorts, and our post-bac program was 11 to 12 students, and UCSF Prime is also 15 students. So I realized that I would need additional support, and I wanted that family away from home, and Prime provides me that support, and be it academically or if I want to discuss any personal matters, or just then with each other.
Yeah, and I echo a lot of the same reasons that Anu chose UCSF Prime as well. It's relatively close to home. I'm originally from an hour north of Sacramento, and Sacramento is where ideally I'd like to practice in the future. So I think it aligns well with where I want to practice. At the same time, for me, I think medical school is pretty hard, and in undergrad I really needed a kind of a small group of people who would support me and had similar thoughts and interests and reasons for becoming a physician. And so I really wanted that same thing in medical school, where I was basically like coming into medical school knowing that these 14 people in my cohort with me are people I can confide in. And if I needed to vent, if I needed to talk about how something was really terrible that we experienced or that we got taught, or, you know, that med school is really hard and I just want to vent, it's really important, I think, to have that avenue and to have those people who support you. They've definitely been a huge source of support throughout medical school, and definitely in these last couple of months when we've been going through a lot of both, like, you know, in the U.S., like there's just a lot of turmoil with the pandemic going on and all the murders of brown and black folks. But at the same time, also like being able to vent about like how much step one was terrible was like a kind of a great kind of release of stress. So the mentorship and support was a big thing for me. And so wherever I went to med school, I knew I wanted to do a Prime program. So that was like huge. And then just to echo again what Anu said, the networking opportunities that you get within Prime is really great. There's like built-in mentorship. There's like somebody on faculty for Prime that does mentorship events and connects you with different Prime alumni and stuff. And it's also great to like be in Prime and then be on the wards during your third year and run into somebody who is also in Prime as like your resident, because then the dynamic totally changes and they're like immediately like trying to get you more involved in things. They kind of know where you're coming from, so you can have more meaningful conversations about some of the things that are going on in your patient's life without feeling like, is it going to be weird if I bring up the fact that you know, they're suffering from homelessness and we can't get them a placement? You know, like, is that going to be weird? Or, you know, if this person's in Prime, I know what they're about, I know what they think, so I can just like really talk about what my reservations are about how we're treating a patient or whatever. So that's another really big thing. I saw that there's some questions. Should we answer them now, or is there a formal kind of place for us to answer? Thank you.
Yeah, sorry, Alexis.
Okay.
Yeah, if you all are finished sharing information, then I can go ahead and field the questions to you.
Okay.
Okay, so the first question we have here, I'm just going to go through the program-specific questions, and then I'll make sure to answer general questions about the webinar and information you'll be receiving at the end. So the first question we got here is, are there 2 Prime programs at the UCSF School of Medicine?
I can take this one. So currently there are 2 as of last year, but we were going to briefly Maria and I were going to discuss that a little later on in additional Prime programs. I'm happy. There used to be an SJV San Joaquin Valley Prime program that was originally at UC Davis. However, since last year, UCSF took over that program, and for that program, it's a 4-year program where you do 2 years at UCSF and then 2 years in Fresno. You do all your rotations at the Fresno hospital, and currently you're not required to do a master's for that program. But I can answer any other questions if you have any specific questions later too.
Great. And the next question is about the application process. So somebody here is asking whether it's a separate requirement, or is it like a check mark that you want to apply for Prime somewhere? And I think Alexis touched on this already, but I'll let him go ahead and answer.
Yeah, so it's something that you mark on your secondary application that you're interested in applying to Prime. And that's true of a JMP as well. So I think during your secondary, you can mark when you apply to UCSF, they like you to send you a secondary, you have like a little checkbox that says, I want to apply to Prime, I want to apply to a JMP. And I think there's also other ones like applying to like MSTP, which is the MD PhD program, and other programs, but they'll be there on the secondary and you will click like, yes, I want to apply to UCSF Prime or UCSF Prime and JMP or just JMP or whatever you want to do. And then they'll direct you towards like the appropriate questions that you need to answer. So you'll have like, I forget how many, maybe like 2 or 3 questions you have to answer for UCSF, 4 questions you have to answer for UCSF, and then there's additional questions that you have to answer that are related to Prime. And they're typically questions asking you like, what is your interest in working with underserved communities? How have you showed that interest? tell us a little more about your background, or maybe they'll ask you about like an important event in your life. I don't remember the exact questions, but they usually revolve around like the mission of Prime, which is to work with medically underserved communities. I'm sure you can find the questions somewhere, but they change every year, so they're definitely going to be different from what Anu and I did. But I'm sure there's like the last year's question somewhere on the internet. And just to clarify a little bit, so there are two Prime programs: the UCSF PrimeUS, and then the UCSF, I guess SJV is what they're calling it. But what we were referring to earlier with UCSF PrimeUS and the JMP, like that's the same program. That's the same cohort of students. That's not a different Prime, but there are two different programs that feed into that cohort. It's a little confusing, but it's the same Prime program.
Okay, and another question about those essays. Somebody here is asking if you have any advice on writing these essays, and how did you craft your narrative / story effectively, especially if you're from those underserved areas that Prime strives to serve?
I can answer briefly, and then maybe sorry. Just real quick, I guess the way that I approached it, and it's important to know that UCSF Prime, they look at your entire application, not just your secondary. And so I like how this question was phrased, and like, how do you talk about your narrative? Because I think it's exactly that. It's important to have a common thread throughout your entire application that's basically just saying like, this is what I'm about. You know, and so when it comes to your personal statement, your disadvantage statement, your letters of recommendation, the classes that you took, all of it should kind of make sense towards what you want to do. For me, I've always wanted to work with like Spanish-speaking immigrant Latino populations. And so I was a Chicano Studies major in college. I was involved with organizations like CCM, Chicanos for Community Medicine, the Latino Medical Student Association. I was pretty deeply involved with Mi Mentor when it first got started. And all of those kind of related back to my ultimate goal and what I talked about in my personal statement, what my letter writers talked about, and about what they knew about me. And so it's important to have that common thread. And so I think it's important both in your secondaries and in your primary to talk about if you're really interested in Prime, talk about your interest in working with medically underserved communities and make it that a highlight throughout your entire application.
Definitely, I echo what Alexis has said. Also, just to summarize what he said, like, be consistent. Don't just bring up another experience that you never mentioned before. If it was super meaningful for you, you should have mentioned it in your primary application somewhere. So that comes across as a little red flag for a certain admissions committee. So be consistent with your narrative. Just share what your own experience is. And what you're interested in. And also when you're applying to Prime programs, if you're really interested in rural health, people really like you being consistent with that. So I am interested in both rural and urban underserved communities. So I did mention clearly on my essays that I'm interested in both. I just didn't take off the rural part just because I was applying to the urban underserved program. It doesn't matter what communities you're interested in, as long as you're being honest and being consistent, and that's backed up by your experiences.
Great. So I'll just ask a couple more questions and then we will try to move on here just in the interest of time. So let's see. The next question was regarding the interview more. So if medical schools know that you applied to their Prime program, and if you have to speak about it during the interview, or wanting to join Prime during the interview, or before.
Yeah, so for UCSF, you have to get accepted into the UCSF medical school before they even offer you an interview for the Prime program. You don't have to mention that you applied to the Prime program, but you can, of course, in your interview, you'll talk about your experiences with underserved communities. So if that's something that you want to bring up, you're welcome to, but you don't have to necessarily mention that you have applied to Prime programs. And interviewers don't really, for the interviews that are for UCSF, the in-person interviews, they're for the MD program, not specifically for PrimeUS. That being said, for certain other programs like UCLA's Prime, their interview has a couple other interview stations that are specifically for Prime students. So on your interview day, you will be speaking specifically about why you're applying to the Prime program. But at least for the UCSF program, it's the in-person interview is for MD program, and then once you get accepted, then you'll get a call you'll have a phone interview for the Prime program where you can talk specifically about Prime.
Great, and I'll just ask one more question, then we'll save the rest for the end of the webinar because we'll have time dedicated to answer more questions. So the question here says, to get into UCSF Prime, okay, yeah, so I think you already answered this. It's if you would have to pass the medical school screening or they screen separately, but, and I believe that was already explained.
As long as you meet all the requirements for MD program, and you're also eligible for the Prime program, but you will have to get accepted to UCSF MD program before you can interview for PrimeUS. Yeah.
Okay, so we'll save the rest of the questions right now for the end of the webinar. Now we're going to move on to Maria's presentation.
Hello, everyone. My name is Maria Cepeda. I am in MS2 now, a rising MS2, and I'll be talking about UCD Prime REACH. So it has a long name, Reimagining Education to Advance Central California Health. And that's a picture of my beautiful cohort. So can we move on to the next one? So I have the mission on here, but I'll just mention the gist of it. So we have this is actually a program for a diverse community for well-distributed medical care, and it's to help California's Central Valley. And in terms of goals, we have that it could strengthen the areas of Central California, the health in underserved areas. To reduce disparities. So it's in general, I think if you start to hear similarities to the previous programs, you'll hear that Prime is very much about serving the underserved. So it's to reduce disparities, reduce inequalities, improve health status, and to form lasting relationships with communities. So a lot of what I see from REACH's mission is that it's basically revolves around the social determinants of health and how ways that we can learn that to break these socioeconomic, linguistic barriers, everything that surrounds the health disparities around Central Valley and Central California in general. So the program curriculum. So first of all, let me tell you guys that this program was previously the San Joaquin Valley Prime, which is a SJV Prime that Anu and I will talk about at the end of this. And so I am actually the first cohort of REACH Prime, which is basically the new SJV with some differences. So the new curriculum has an immersive program. So again, it has that summer orientation. It has that group bonding, community-based. We visit community-based organizations, and we also meet a lot of the key faculty. In addition to being involved in what is called the pre-matriculation program. And the pre-matriculation program is actually part of UC Davis, and we are immersed in that program as well, which is to learn study strategies and to transition into our first year of medical school. In the first year, which is similar to the rest of the years, we have a lot of seminars and workshops. And in those seminars and workshops, we actually have a lot of interprofessionalism where we work with other Prime programs, such as Rural and Teach, which will hopefully soon be a Prime program as well. And we also work with the nursing school. So that's what a lot of the seminars that we do, which are focused on social determinants of health, again, leadership skills, advocacy, specific to Central California. So I'll share a little bit of what an example of a workshop that we had that I did, and it was I collaborated with Rural Prime and Teach, and teacher, which is for urban communities. And we discussed about disabilities. So my participation was to discuss disabilities within Central California, specifically Central Valley, which is where I discussed about pesticides. So that's just an example. We also have preceptorship throughout our years, and our preceptorship is within healthcare centers that are in Central California, and they're year-long. For first year, we do outpatient, and for our second year, we actually do inpatient clinics. The key thing is that your preceptors become your mentors, and that's a connection that revolves around most of the Prime programs, where you're connected with your preceptor, and they're people that could actually mentor you throughout your years. After your first year, we have summer projects that we have to do. Unfortunately, this time around, because due to COVID, we weren't able to do a lot of the clinical experiences in person, or a lot of the community-based projects that we were going to do. So a lot of us have dedicated ourselves to doing research. That's what we're doing as REACH. We're dedicating ourselves to doing a research project on our own time. But the ones that the programs that you could be involved are there's a course called REACH in of itself. It's Research, Education, Community Health, which is based in Modesto for most of it, and that's one of the programs that they offer. There are, as I said, the Community Engagement Project, which is it's a research project with community health, and you also have the option of doing anything else. For example, right now I'm involved in the Summer Institute of Race and Health, and we learn about cultural humility and racism and how that affects the health of our populations. So we have those options. Again, our second year, that's when we would present our community project presentation. In this case, since we weren't allowed to do our community engagement project, we will most likely be doing presenting our research project that we are working on. And again, we have the seminar workshops and preceptorships. Rotations are usually in Stockton, Modesto, and North Central Valley now that we're not SJV. So those are the three specific places that we would be doing most of our clinical experiences in. Our fourth year, we are dedicated to giving back. So we have the possibility of doing clinical skills facilitating, where we actually teach other students that are in their first or second year, and we teach them clinical skills, which is something, as I experienced as the first year, I actually had a facilitator that was from a rural or SJV, and they were the ones that were, they were becoming our mentors, but they were our teachers during this time of clinical skills. And we also have the option of doing a scholarly project. Again, it's similar to the community engagement project, a little bit more based on research. And we also have the possibility of becoming part of the admissions committee to involve more students that are interested in REACH Prime. And again, interprofessionalism, again, we worked with the nursing school and we work with other Prime programs as well. And the mentorship is just continuous. So program application. So it's a lot of Prime programs are very different. But the ones for Davis, it's very similar in that you actually do the primary application, you complete that, and then you'll get the secondary application. In the secondary application, you'll check off that you have an interest in REACH and actually do a supplementary question, which is usually about 500 characters, not that many. So that's something that Davis does in their application. It's actually, for me, it was one of the hardest applications because I had to say so much in so little space, but this is just one question that REACH does, and usually it's about ties to Central California or your prior experiences with Central California, and you would say that in your 500 characters. Criteria, again, you don't necessarily have to be from Central California, but you have to identify in some way, and I'll speak a little bit about that in my why REACH, my unique story about that. And but you do have to be committed to working in Central California after graduation and residency. You do have to have a strong mission for doing something for the communities that need us in Central California. And the interview, so then after that, after you do your secondary application, in the interview phase, they would pick out of the pool of people that were interested to see who was a strong candidate and give them a video conference. So I remember that's one thing that you didn't have an in-person interview, but you did have an in-video conference, and usually there was a panel of 2 to 3 people, usually faculty. Now we're involving more of the alumni, so we're also involving people that have come before us to help with applications. So this year, actually, a lot of the members from my cohort participated in the application process, where they were a part of this interview, and this revolves around the big familia concept that UC Davis and Prime specifically embodies. And we wanted other people that can connect to us during the interview to make this interview more community and family oriented and not really scare people, because this is what really Reach Prime is about. One thing is that there are about 8 students accepted per cohort, so it could be a little competitive. Usually there's a longer wait list as well. So you want to make sure that in your 500 characters, you're to the point, and you are very specific in that you show and identify with the mission of Reach. And again, my beautiful cohort again. And I keep saying this because we are a big familia, and this is actually the definite my why Reach, because once I met the people that were interviewing me, I was like, okay, I'm definitely gonna go for this, because they were they seem very caring and very supportive. And apart from that, I think I really connected with their mission. I'm personally not actually from the Central Valley. I am from a valley. It's called San Ynez Valley, which is a very unique valley in Santa Barbara County. And I'm surrounded actually by grapevines. I'm surrounded by a farm working community. So I really connected with the agricultural and rural aspect of Central California. I mean, that's who my family is. My family, my own family, my immediate family actually is a working population, makes up the working population in my community. And they have been, I live on a ranch, so I really identified with the mission that they had of serving Central California, specifically Central Valley, because to me, when I was able to do a little bit of investigation about the health disparities in Central California, I realized that is my community. I want to be in the future working with farm working communities, immigrant communities, and the Latinx community, breaking those socioeconomic and linguistic barriers. And the way that Reach was helping me do this is I'm actually the Reach cohort liaison currently, which is like the student government. And this way, since this is our first year, we're becoming the pioneers of our own program. And to tell you the truth, it's been very fruitful, because the faculty members are actually very responsive. And if there's something we didn't like, say we didn't like a seminar or workshop or something, or some sort of format, they change it in a snap. And that's what they have done for us. If there's we're kind of making this program what we want and making it better for the generations to come. So I think instead of looking at this as like, oh wow, it's only been a year that you've been in this program, there is a lot of change going through this program, which will allow for other future generations to actually do something good with this program for the future. So I think it has a lot of room for change and a lot of room for us to be the pioneers and actually make this program what we want it to be for Central Valley and Central California. And I've done also the mentorship where I'm part of the Big SIB program. I actually have my Big SIB, it was an SJV, is an SJV, and she helped me a lot. So now I'm here to be a Big SIB for future generations and the next medical students that will join us, which will be all of you, which soon will be our colleagues. And again, I talked about the research project. We will also be taking on SHEC, which is a Stockton Health Empowerment Conference. And we will soon be also implementing that to part of our program, because it is near and dear to our hearts. And most of the years, the people behind SHEC are usually people that want to serve Central Valley and Central California. So our clinical skills group is actually my cohort, my Reach cohort, which is my familia. And just to give you guys a sense of how close we are, We can put the next slide and show the video. It's a very short 40-second video where we talk about who we are, but it's a funny video at the same time because we put it together in a day. I think it was right before an exam, but this shows how close we are.
Here, I'm trying to play it, but there we go.
Can everyone hear it? I don't think people can hear it. Christina?
Oh, okay. One sec. Let me try to open it on the other window here. Oh, here it is. Is there audio?
No, I don't think I can hear it.
Shoot. I think I have to. One sec.
If not, it's okay. You can just go ahead and show it, and then I'll explain a little bit about it.
Yeah, I'm so sorry. It looks like it'll play, but
It's okay.
there's an issue with the audio.
It's okay. So basically, the video it talks about what the Central Valley is and why we're doing reach. And I think the most important part was that we had in the background like a song, and we actually grabbed things that were nearby us and just put this together. Like I think it was a day before an exam or something, and that just showed I think that how resourceful we are and how close we are. Unfortunately, you can't see it, but the gist of it was that it said we started from the bottom, now we're here, and then at the end you would see somebody that is actually in the cart, and then it's showing all of us together. So I think that's the biggest part of it. So yeah, so we can skip it. It's okay.
Okay, sorry about that. I'll see if I'm asking somebody right now if they know how to change it. So we'll try to get it at the end, but I guess for right now we'll just jump into any UC Davis Prime Reach specific programs questions. So if you all have questions on this specific program, please go ahead and type those in the chat box. You gave a lot of really detailed information though, so thank you. So there's
no problem
about is the Big SIB program only for Prime students?
No, so it's actually a general program within UC Davis, but not everyone is a part of it. But as Prime, most students are a part of it because since the cohorts are so small, we try to take on a small SIB so that we can help them out throughout, since they'll have the same extra curriculum from the traditional path, which is going to the seminars, doing the community-based health projects, and just the extra time that we have. So I think usually they pair us up with the previous cohort, and that's how it'll work this year as well.
And then somebody else is asking if there's a Prime program and a Prime Reach program at UC Davis.
So Prime is like the umbrella, right? Prime is an umbrella, and as it is for all of California, and there are different programs within it. So at Davis, there's Reach and Rural, which are officially part of Prime. Teach is in the works of becoming part of Prime. Teach is for the urban underserved. And there are other special track programs such as ACE, which is like an advanced program that is for commitment in primary care, and it's done in 3 years. So that's a different one.
And then somebody else is asking, what is the difference between SJV Prime and Prime Reach?
Yeah, so I guess we can talk about it now. Anu, maybe you can pitch in as well since the question is there. But I can go ahead and talk about from what I know, since we are like the new, I guess, SJV, and we still have 3 cohorts going of SJV. I can talk a little bit, and maybe you can add your perspective from UCSF if that's okay, Anu. So the difference is, so that's one of the differences, I guess, that now, so the SJV used to be a part of Davis, and it has now it has a new home, which is UCSF Fresno, and they have taken over. It will be, I think, similar curriculum, but they're taking over. And so Reach will now not be doing a lot of the work in Fresno, because that will be specific to SJV, which stands for San Joaquin Valley. So it's also the San Joaquin Valley and surrounding areas as well. I don't know if you know a lot about the curriculum, the current curriculum, Anu, maybe, or something that you can add on to that.
Yeah, so at UCSF, what it is the first 2 years are basically a year and a half. So we finish our first 2 years in 1.5 years. And then the 3rd and 4th years, SJV Prime students go back to Fresno and do all their rotations in Fresno hospitals. During 4th year, they have an opportunity to do rotations elsewhere at other hospitals too. But during 3rd year, all their rotations are done at Community Regional Medical Center, which is the local community hospital in Fresno. And their seminars and community-based activities are also all staged in Fresno. So they work with the vulnerable and marginalized populations within Fresno area, and a lot of their seminars are conducted at UC Merced for academic training.
Yeah, and I'm just going to clarify one point. In the current Reach cohort that we have, there are people from Fresno that are dedicated to serving Fresno as well. So it'll still be a little bit more open, yet San Joaquin Valley in general will be mostly UCSF Fresno now. I think that's the biggest difference for right now.
Okay, and somebody else is asking a program about Prime Reach here. They say, your program sounds amazing. I'm from the South Bay area, and I'm passionate about helping underserved communities. Would you say this program is a fit for someone who has grown up in a rural/valley area?
Yes. Thank you so much, first of all. And I really connect. I'm from a valley. I'm not from the Central Valley specifically. So yes, if you identify with this mission and you're dedicated to doing your rotations in Central Valley and Central California and learning more about farm working, agricultural, and rural communities, so I think Reach would be a really good fit. Rural, we do have a Prime Rural as well at Davis, and rural is more general, so it's not just within the Central Valley of Central California, it's all over California. And I remember having this question myself when I first applied. I was like, okay, well, should I do Reach or rural? I applied to both, and I was fortunate enough to get an interview for Reach, and actually I think Reach was the best fit for me because being from the valley, from San Ynez Valley, which is near the Central Coast area, I have like nowhere to go. If you look at all the Prime programs, if you look at even schools, there's no school around Santa Barbara County. I would either have to do UCLA or UC Davis, and the one that I connected to the most because of the place where I came from, which is a farm working community, again, the grapevines, the vineyards, it was UC Davis and Central Valley.
Thank you. And I'm going to change slides here because quite a few people have questions about other Prime programs. So I'll see if you can answer a couple of these. And then I do want Anu and Alexis to answer one of the UCSF PrimeUS specific questions. So let me just ask you a few of these. So one of them is asking, let's see. So can you talk about UCD Teach MS? The student is interested in how it compares to PrimeUS at UCSF, since both emphasize working with underserved urban communities.
So I can talk a little bit about it because we do a lot of work with them, but I wouldn't know exactly what their specific program activities are, because that's their program. But they do a lot of work with us in terms of seminars and workshops and leadership building, leadership skills, so that we can become better advocates for health disparities. So they do a lot about that. What I do know is that they're committed to working in an urban community. Their rotations, I believe, are around here in Sacramento, and usually it's just in urban, for urban community, in urban community. But I don't know specific activities that they do. One thing that they do adopt is a Summer Institute for Race and Health that I'm currently doing, actually. So they're all required to do that program, and they for cultural humility, and that builds on their leadership skills and advocacy too.
Great. And then, do you all know if all UC medical schools have a Prime or similar programs?
Yeah, I can briefly talk about other programs. So one thing I wanted to mention about UCSF PrimeUS versus Teach is that UCSF Prime, you're required to do it. However, for Teach, I think it's a 4-year program, but for UCSF Prime, they do, the expectation is that you do a master's year or a scholarly research of that source. We talked about the SJV Prime program briefly. That was at Davis, but currently is at UCSF. There are other Prime programs throughout California. So UC San Diego, they focus on health equity. It's called Prime HEQ. And then UCSF or UC Irvine focuses on Latinx community. So one of the requirements for their program is, I think you have to be fluent in Spanish, and one of the interviews is conducted in Spanish. And for UCLA, they focus on leadership and advocacy. It's called Prime LA. And we spoke about UC Davis Prime programs and UCSF Prime programs. However, regardless of wherever you go for Prime programs, there's also an annual Prime conference that's held at different UCs each year. This year, it was supposed to be held at UCSF. I mean, it is being held at UCSF, but it's going to be through Zoom. It's going to be a virtual conference. But each year, it's held at different UCs, and you can still connect with other Prime students or faculty members from other schools, even if you don't go to those Prime programs. But like Alexa said in the beginning of this presentation, the focus is underserved communities within California, and each UC focuses on a specific population based on the resources that are in the surrounding communities near that school.
Thank you. So it's almost 7 o'clock. We can go on for about 10 minutes more or so, and then we will have to conclude this webinar. So I do want to just take this opportunity to ask another UCSF question that was sent in earlier. Somebody wants to know if UCSF or these Prime programs are focused on recruiting California residents, and if you happen to know what % of matriculants are out of state.
So for UCSF, about a third of the students every year are out of state. It's about 2/3 are in state. So in a class of 150, that means 100 are from in-state, and about 50 are out of state. We just got a new dean of admissions, so I don't know if that's going to change, but they'll probably try to keep it around that. And as far as Prime itself, in a newly cohort, I think there was about 4 people who were out of state, and then 11 of us who were in state.
Great. Thank you, Alexis. And another question about the UCSF Fresno SJV Prime. Does this program only accept Central California students? And let's see, they're asking because the majority of current medical schools in the program are from the Central Valley.
Like it was mentioned earlier, I think Maria mentioned this, you need to have some sort of ties to Central Valley. That way you are able to connect with those communities, and you need to show some sort of demonstration like in your previous work or some sort of interest in working with the populations here. And if you are a native of Fresno, you do know your community better than those who are not from this area. So they do give preference to that. But I think as long as you can show that you're interested in learning about those communities, or you have demonstrated in your past experience that you have some sort of connection to that, to the area, I don't think that should be a major barrier for you to apply.
Thank you. And somebody's asking if you know, or if you can repeat which Prime program conducts the Spanish interview.
That's Prime at Irvine. So Irvine is focused on Latino community. So part of the requirement is that you do an interview in Spanish. And it's really not that bad. I interviewed for UC Irvine Prime, but you definitely have to like know how to speak Spanish. You can't really fumble your way through with like a semester of college Spanish or anything like that.
Okay, and since it's 7 o'clock, before we get to the rest of the questions, I just wanted to remind everybody to please fill out the surveys that will be sent to your email. And if you do this, then you'll have access to the presentation and also the contact information for the presenters. And Maria put her email and Instagram handle on the chat box, so be sure to note that down. So the next question I have is, how does the committee decide which students to interview or accept into Prime? If any of you know about that process.
So at UCSF Prime, once you decide that you want to apply for Prime, you're offered an opportunity to go on like a Prime interview day. That doesn't mean that you're going to be interviewing for Prime on that day, but they're just going to give you more information. And so everybody who is interested can go on those days if they're available and if it works for you. But the way that they actually go about choosing who to interview, everybody that applies for Prime and who gets into UCSF Prime, or sorry, everybody that applies for Prime at UCSF and gets into UCSF will be offered an interview, I believe, right? I don't think they screen beforehand. And the interviews are conducted by Prime students. So I think both Lanu and I have served on the admissions, on the interview committee for Prime, at least 1 or 2 years. So we each interview like 3 or 4 students. It's a set question that there's like 6 or 7 questions that we ask, and it's set questions. So you just kind of ask these questions. It's a phone interview, although hopefully we can start doing like Zoom interviews. And then at the end of that, we write a report, and then that's submitted along with the rest of your application that will then ultimately be reviewed by the faculty at UCSF Prime, and they'll ultimately decide who gets in. But I think that our kind of impressions and our interview with you is a pretty big factor into your matriculation to the Prime program. I'm not sure how it is at UC Davis.
Yeah, so it's pretty similar. So yes, first you have to do your primary application. Once that's done and you get accepted to UC Davis just in general, then the Prime programs actually will look at your application, and they actually do a screening, and they actually look at the strongest candidates for their programs, and then offer you a video conference interview, as I said in the, and I think that's for all of the programs. They do a video conference interview, and usually this year, at least for REACH, I know that they've implemented more of like our current cohort is part of the interview process as well. So they're part of the video conference when there are other 2 to 3 two other faculty members, sometimes 3, and then now they've added 1 person from our cohort or a previous cohort that can speak to any questions. But definitely, I do think that the way that the interview is structured, I think can speak a lot to how you would resonate with them. Like I said, at least for me, that was one of the biggest factors too, that I'm like, yes, definitely REACH, because I really saw that family and community component from my interaction with my interview.
Okay, and a question that keeps coming up in different ways is what can students do? What kind of opportunities can they be involved in to be competitive applicants for Prime programs and serve these medically underserved communities?
I think what Prime really focuses on is commitment. If you're really committed to your communities, it doesn't have to be rural. It can be any communities. And then every community, have their advantages and disadvantages as long as you are aware of your communities and you have demonstrated interest in those communities and learned about them, and you're willing to make a change in those communities as a future provider and a community advocate. That's the most important thing. Rather than just doing a one-day volunteer here and then switching to another place, going somewhere else, they really look for a longitudinal commitment to a particular community that you're hoping to make a significant impact in as a physician. I think that's something that all admissions committees look at when they screen for applicants, just like the time commitment.
Thank you. Did Alexis or Maria want to add anything to that, or maybe how they believe they were chosen as competitive candidates?
I actually that's exactly right.
Yeah, so I think just one thing to add, I think really just be yourself. I think as PrimeUS, we're always trying to check off boxes and trying to fit the cookie cutter of every single program, and we're like, okay, this is the program I like, I have to do all these things to fit that. No, be yourself and find things that you really love and you're going to talk about, because they could potentially ask about this on an interview, and that's what they want to hear, your passion, why you really want to be a part of those programs. And I feel like naturally you'll fit into the mission of one of the Prime programs. If you do something for underserved in general, most of the Prime programs are for underserved communities. You would just have to find what specific population you would like to work with. And as long as you're doing something for that specific population, and then you can speak with passion about it, I think you're set. You don't have to really have a cookie cutter of oh, I have to do research and I have to do community work for this population. I have to do all of these components. As long as you can really speak to their mission and why, I think you're perfectly fine.
Just wanted to add one more thing. I know I had no research experience or very minimal research experience applying into UCSF. I thought I wasn't going to get in because UCSF is #1 funded school by NIH in terms of research grant money, and I was still able to get into that school. So it doesn't have, that's just Maria mentioned, you don't have to be cookie cutter. You don't have to follow the crowd. Do what you're passionate about and show that in your application. I was involved in a lot of community projects, and that's what was reflected on my application. Yeah, and then also while applying to programs, really read their mission statements and see what they stand for, and then see if you fit their mission. That's how I screened a lot of schools when I was applying, just reading at the mission statement and seeing what kind of populations they serve and what were their goals for their students and for their community. And that's how I kind of cut down schools where I wanted to apply.
Thank you. So we have time for one more question, and I'll just pull from the ones that were sent in. And if you, Anu, Alexis, and Maria, can provide some advice to students on how to seek volunteer opportunities in the Central Valley and also in light of the current pandemic.
As far as how to get involved for the current pandemic, I know that there's a ton of need for people to do contact tracing and to volunteer at. There's different studies that are being done to try to find out who is infected and asymptomatic, what the rate of I guess infection is for those who are asymptomatic, and there's a ton of work being done there. As far as specific to the Central Valley, I don't have an answer to that.
Yeah, I think, oh, sorry, go ahead. Okay, so I think more than just specific to Central Valley, I think it goes in general, because Central Valley is just it's similar to other places where you have to, sometimes if there aren't volunteer opportunities just explicitly promoted, I think sometimes it's our duty to reach out to maybe some healthcare workers or some institutes so that you could actually ask if there are volunteer opportunities. I know I did it for myself, that I sent some emails to specific doctors asking like, oh, can I do this? Researching for free clinics, I think is really big. Research what are the free clinics that are out there and that you could potentially do medical assistant work or things like this. Now that we're in the pandemic, many ways that you could actually help is you could actually like reach out to the different healthcare workers and ask what ways they are needing help during the current situation. There are still a lot of food banks where you could help and that might need your help, and that shows a lot. I know specifically to reach, we do a lot of work with the food banks. Now that we were in the pandemic, it was canceled for us. Everything was canceled for us once we were quarantined. But now you do see a lot of food banks doing their work and still feeding schools. So that's like a really good way. Or even conferences that are going to be now online. Reach out to those conferences. Stay connected with Mi Mentor. They do a lot of promoting for conferences that are in the Central Valley as well. One will be SHEC. So we still have yet to see if we're going to continue, how we're going to continue doing that. But since it has been 300 to 400 students yearly, I think it's definitely an opportunity that we're going to need maybe volunteers, even screening questions or something to make this happen. I think that actually means a lot during this time because you're actually helping a cause to bring pre-medical students and bring us all together. So I think it'll really be a great opportunity for all of us to actually show how much energy we still have during this time and what we can do and how we can be resourceful during this time. So definitely don't shut yourself down if you can't do a clinical experience because there are other different ways of doing clinical work that don't necessarily have to be in person.
Just one more, I just wanted to add one more thing that you can also help by just like sitting from home. You can translate some resources if you are bilingual for the communities that do not have access to those resources. So that's something that I did when my rotation was canceled. I was able to translate some of the CDC resources and UCSF resources into Punjabi and shared with my family members and my community members. So that's also a volunteer opportunity for you that you don't have to go out of the way to look for. And like Alexis mentioned, there's a bunch of research studies going on that you can email PIs of principal investigators to participate in. Just reach out to people, and there's a lot of help that's needed, and someone will, not everyone will reply back, but someone will. So just like reaching out to people is, I guess, the biggest thing that you can do, especially in this time when you're not able to do volunteer stuff outside in the community.
Alrighty.
Yeah, could I actually add one more thing?
Yeah, go ahead, Maria.
Sorry, real quick. That actually reminded me. I have seen a lot of opportunities where you can do translation work. So translating pamphlets, like that's something that for many years, I think a lot of community health centers have tried to work with, and it hasn't been able to happen because they've been really busy doing the in-person work. And now that that we have the pandemic and we're quarantined, I think we have a lot of time to actually put a little bit of effort into this, into translating for a lot of our communities. So really look out for that if you are fluent in your language and you would like to help out. I think that's a really good way to also reach out to community health centers as well.
Okay, well, thank you all so much for being here today and for presenting on the 2 Prime programs and also giving a lot of useful information on other programs. So for everybody who is still here, again, I would just want to remind you to fill out that survey so you can have access to the contact information if you didn't grab it from the chat box, and also to the presentation slides. And I hope you all have a good evening. Thank you.
Thank you, everyone.
Bye, everyone. Thank you.
Reach out if you have any questions.